So, hi, I'm Syra, I'm practice manager at Hiyos. So really excited that we've been approved as a training practice.
It's been a long journey, but definitely been worthwhile.
Means that we're going to be able to train new GPs and hopefully bring more GPs where they're much needed at the moment.
Means meeting loads of new people, getting their ideas and help developing us and them as people, and it's going to be great.
We are in a really fortunate position where we expect to have 4 trainers. Each trainer can have theoretically 1 trainee. However, as this is our first year of being a training practice, we plan to have just the 1 trainee, GP trainee.
This is a very high level trainee, so it's not somebody in medical school who's not allowed to prescribe or do anything. This is a trainee that's done many years of training, and they've also worked in hospital in a variety of wards. They've had probably more recent experience of acute medical conditions than myself, because mine would have been a few years ago. So their level of knowledge for acute conditions is very high, and here they're learning to manage more chronic conditions and our patients that have got more multiple conditions that we manage.
As they sort of grow into the role and as they gain experience, they become independent because they are already fully qualified doctors, but all they're doing is specializing in the GP aspect. There isn't any marked differences between the level of care that you expect from a trainee and a qualified GP.
A training practice is basically a practice that has been approved to train the GP registrars in becoming future GPs.
A training practice has to be approved by Health Education England. So the practice has to be approved as a suitable learning environment for trainees. Before we applied to become a training practice, we had fantastic support from GP practices, both in our PCN, for example, Crosslands, and also other practices who came along and visited us to make sure that we were compliant and helping us prepare for our training practice visit.
We worked quite hard, to become a training practice. There's a lot of structure in place, so you have to create a timetable both for the trainee as well as the educator, and make sure they have protected time to actually teach and catch up with the trainee.
So after doing your 5 or 6 years of medical school, 2 years of training in hospital placements, then you do 3 years of postgraduate training to become a GP. And during your 3 GP years, you're doing various assessments. You're being assessed consistently on your placements by supervisors. And then you also have a few big examinations as well, both written and practical examinations. So yeah, it's a lot of work. And then after that, you become a GP, and then you need a few years of practice at a GP. And then after that, you can apply to become a GP trainer. Part of the application is you have to show your involvement in teaching. You have to attend various teaching courses. And finally, you go through a rigorous interview with various senior members of the teaching faculty, where they interview not only you, but also the practice to assess suitability. And I'm very happy to say our practice met all the criteria. We're really enthusiastic about teaching, and we're really looking forward to it.
There's a really good support network for training practices.
So I work closely with the managers in the area. This is really useful because we can kind of share learning, and if we need any help and support, we're all there. It's also, we've got a lot of resource online as well. So a lot of support for the trainees, the educators, the practice managers.
The GP trainers, the people who are approved to train the GP trainees, do work in collaboration with other trainers in the area, where they can discuss or sort of troubleshoot any issues that they experience.
Once a month, the trainers who are approved GP trainers attend a trainers workshop where you have the opportunity to discuss any challenges or anything new that's coming along for training in general practice.
For the GPs itself and for the clinicians, it's very beneficial because you are constantly trying to maintain the highest clinical standards by making sure that you're practicing evidence-based medicine. At the same time, you're more aware of the clinical developments, the clinical guidelines, and you have to, in order to maintain those standards, or in order to be a training practice, you have to constantly make sure that you are attending or you're up to date with all the clinical developments.
So it's a fantastic benefit to the patients, because trainees generally, they get a little bit longer to see the patients. They can spend longer talking to patients, making sure the patients feel like they've been heard, and they get not only seen by a fully qualified doctor, but also then the trainee can consult with their supervisor, which, for example, might be myself.
So it does take a little bit longer for patients, but actually you do get sort of two opinions, and quite often there's a discussion to which obviously patients can often find that quite helpful and meaningful and engaging.
The other benefit for patients having a practice that is a training practice is that there are more clinicians available to help with the issues at hand.
I personally do believe that patients can actually directly contribute to the training of the future GPs. So I think you're ensuring that the best care is provided to the patient.
We already have a learning environment. We have a good culture within the practice where we always look at ways in which we can improve. We look at our processes, how we currently do things, how we can make it better. So it's going to be really useful both for us and the trainee. And I think it'll bring us, a fresh perspective.
We talk to everyone. There's no kind of hierarchy here, so everyone talks to each other. We all share ideas about who we are, and like discussions, clinical and non-clinical, about how we're all doing as people and how we can develop. So it's great, and we already kind of fit that learning environment very well. A trainee here would be very well supported. We have lots of clinicians that are always available to ask questions, and there's loads of support on Teams and in person. So if anyone ever needs anything, everyone is always there to support each other.
I was welcomed as a student. I learned sort of how to walk in this practice. I was introduced into how a GP practice is run. I was showed how to sort of take care of patients, how to build a really good relationship with them. And I just feel like I was supported really, really well from Dr. Mahmood and everyone else. And what makes it so special is everyone definitely works together as a team. Everyone, comes together every single day.
It's more than just providing care to the patients. It's for looking after the whole community.